Hello everyone and welcome back to my channel. So today we want to talk about phobias, everything about phobias that you need to know. I am not going to talk about trypophobia in this video because I have goosebumps just mentioning it right now. Alright, so let's get right into the video. A phobia is when you have intense or even overpowering fear and anxiety in certain situations or when you encounter certain objects. While phobias can involve same things as ordinary fears, the effects of phobias are more severe. In the most severe cases, people with phobias critically limit their lives to avoid encountering what they fear. Some of the most common phobias under animals would be arachnophobia, which is the fear of spiders. We have xenophobia, which is the fear of dogs. Entomophobia, which is the fear of insects. Ophidophobia, which is the fear of snakes. Then we have some phobias under natural environments, which is acrophobia, fear of heights. Agoraphobia, fear of public spaces. Aquaphobia, fear of water. Astrophobia, fear of thunder and lightning. Then we have blood and medical procedures or injuries, fear of pain, which is algophobia. We have dentophobia, which is fear of dentists. Hemophobia, fear of blood. Trypanophobia, which is fear of needles. And then we have situations, aerophobia, fear of flying. Amaxophobia, fear of driving. Claustrophobia, fear of enclosed spaces. Nyctophobia, fear of the dark. Then we have other fears, which can be fear of fire, which is pyrophobia, just like I said. Trypophobia, fear of clusters or groups of holes. Now let's look at some of the causes of phobias. Phobias are when your brain takes fear and anxiety to extreme degrees under ordinary circumstances. These emotions can be protective and helpful. They are your brain's way of warning you that something is wrong and you might be or are currently in danger. But experts don't fully understand why these emotions turn into phobias. However, several factors and processes may contribute to having a phobia. This includes traumatic experiences. This can be experiences that happen to you or that you see happen to someone else. Next, genetics, informational transmission. Some phobias may happen because of things you learn about or things you see or hear repeatedly. The next thing will be learned fears. People can learn about phobias or fears of others and they may develop a phobia as a result. This may be a factor in why people with overprotective parents may be more likely to have specific phobia. Now let's look at some of the ways you can manage or treat phobias. Treating phobias can involve mental therapy. The formal term is psychotherapy, medication, or a combination of the two. The treatments can depend on the type of phobia you're experiencing, how severe the symptoms are, and the factors related to your lifestyle, routine, and preferences. A healthcare provider can tell you more about the possible treatments that can help you. Now, are phobias preventable? Phobias happen unpredictably and they can vary widely from one person to another. But that's partly because fear is something that each person experiences differently. Because of that, there's no way to prevent phobias from developing. There's also no known way to reduce your risk of developing them. Next, we'll look at living with a phobia. How do you take care of yourself if you have a phobia? The most important things you can do if you think you have a phobia includes: the first thing will be to seek help. You should seek help as soon as you notice phobia symptoms disrupting your life. Getting help sooner can make a big difference in your recovery. Next, follow treatment guidance. If your healthcare provider prescribes medication or recommends regular mental health visits, following them can make your treatment more effective and help you faster. Finally, don't underestimate the value of lifestyle changes. Staying active, eating a healthy diet, getting enough sleep, avoiding alcohol and non-medical use of drugs, and managing your stress and mental health can all help you as you work on managing or overcoming a phobia. This brings me to the end of today's video. I hope you've benefited from it. Kindly subscribe and see you in the next one.